So you wash up to the elbows.
Okay. Wash up to your forearm. Make sure you get under your nails. You want to clean each nail. You want it to be lathered enough where you're making sure you're lathering from tip to here. Okay.
So it doesn't have to be antibacterial.
And the soap helps.
Okay.
Because it's the friction and the
Okay.
lather. Any soap will work.
Yeah, and you know, what else happened? Well, I had IVs from here to there for the longest, but I try to keep my nails short. For one thing, I haven't cut them lately.
Go between your fingers, top of your hand, sides. And then you want to individually clean each nail. Make sure there's getting lather under your nail.
Let me ask you something. I have a nail brush at home. Would that be okay?
Got all kind of germs on it.
Well,
depends on how well you clean. I prefer to just stay away from it.
Okay. But
You
normally
sterilize
I don't
it.
even have nails. I mean, I keep them cut that close. Well,
You can get you some of that blue sterilizing stuff the nail place has.
Yeah. What I'll do is I need to cut them off like short where there's really no under the nail almost.
Yeah.
And those are fine what you have.
Yeah. But I like them like right now, just so that I don't scratch anything. That's what I'm afraid of in my sleep. Is that incision is itch.
And just use disposable paper towels, no bar soap, because you don't want to transfer.
Raina, you can get that shirt. I'm going to let you grab it.
The black one?
Yeah.
Okay.
Yeah, I have a roll of paper towels actually in the bathroom that, you know, I don't necessarily always use them, but.
What is the time? Like 30 seconds?
20.
20 seconds.
I need to pay attention, but.
That's
Say
okay.
your
By the time you
ABCs.
actually simulate a surgical scrub, a true one where you actually scrub from tip to forearm and you cover all skin surfaces, it'll take you 20 seconds.
Oh,
Sing
yeah.
Twinkle Twinkle Little Star. That's what I tell the girls to do when they're brushing their teeth. Good job, Mommy.
Here, some more so you can dry it a little bit better. They're tons. About every other chair there should be one.
Yeah, there's one right there, Mom. I'll take it.
I hit these spots.
Here.
Elena, where I start going. But don't think I'm falling. It's just kind of a.
Off balance.
Well,
thing.
no, I hit kind of one of those nervy spots, and I have to kind of. It's like it has to take the long path back.
Oh, yeah.
I look like a robot doing this.
You need to be moving like a robot first.
Okay, here's your card.
Yeah.
So tell me everything that you need as you recall.
Well, the only thing I didn't have were the Q-tips.
Alcohol swabs.
Yeah. And then.
So you lay everything out like this. At home you use a non-porous surface that you can wipe down and sanitize.
So this is what you're going to be doing at home.
Right.
You need a little table like this.
I've got one similar.
You use a tray, anything that you can clean and sanitize without damage.
Yeah, Mike bought
Is
one.
it non-porous?
Yeah, well, it's just like this, except it's about
the damage it.
but it's about this big.
Good.
Okay.
So I'm not going to actually.
Read the card.
I'm not going to actually
area,
open this.
wash your hands. Surprise it gather. You got everything you need. You got to have alcohol, sodium chloride, medication, sodium chloride, heparin.
Right.
Okay. So we'll flip over, make sure your IV's unclamped. It'll always be unclamped unless you have an emergency. And it's talking about right here. This purple clamp should always stay open. This is a positive pressure valve.
Okay.
So we don't want you to clamp it or deactivate the valve.
Okay, so I'm not going to mess with
The only
any.
time you would clamp this is if some type of emergency happened or we instructed you to blood coming out.
Oh, okay, so that stays open.
Clamp always open.
Always, okay.
Okay.
Then it says cleanse your injection cap with alcohol.
Now that's what I was, okay.
And that's 15 seconds.
That is that, because on there it looked like it was these. And I'm like, well, you're supposed to take those caps.
Well, they didn't actually do that. I think they're just showing you how to, they're not showing you a picture of every step.
Okay.
They're like taking the best one out of the three.
Yeah, because I was like, clean the injection cap, and I was like, okay.
So this is what you will be doing at home, right?
Right, but I'm going to clean that.
Okay.
Because on there, I thought it was that.
And you're going bullseye when you do it. And you're going to have to put some pressure because you got to go bullseye the blue and twist till you get it locked on there. Not too tight because you want to be able to untwist it, okay? So I tell patients they're doing it at home, they're all by themselves, there's nobody to help them. Hold it between those two fingers so that you can use your thumb and your forefinger.
Okay, should that be down like a little, like better grip. Like, right, okay.
And you're not using that, you're just holding it there so that you can maneuver.
Right, okay.
When you go to flush it, you're just going to put it between your thumb and forefinger so
Okay.
that you can hold onto it firmly.
That's how I carry my keys on the way to a parking lot so I can stab somebody.
So I'm cleaning this now.
And you're not swiping, you're actually cleaning. Like I said, tell people you're cleaning your floor. You're trying to get stuff out the crevice there.
Yeah, I'm going to hold, well, let me.
And you're doing the outside, but you're also doing the inside. You don't have to do that. Actually, if you just open it, like, I mean, you don't even have to open it. If you just do that.
Okay, okay, yeah, my big fat fingers just kind of.
You got daddy hands.
I know. I was like,
she went to get her nails done, and the nail people told her she had daddy's hands.
I know. He goes, "This your mama?" I said, "Yeah," because she had these real pretty, nice shaped nails. Like hers have that nice arch to them. He goes, "Well, let's take after daddy, wide and flat." So I'm gonna be.
What'd you call it? Rooftops?
Yeah, housetops.
They are really wide and flat.
Yeah, I see kind of what I'm saying. This, I feel like I don't have a good.
You're fine.
I just feel like I don't have a good.
You are doing fine.
Yeah, see, my big fat fingers don't want to. Okay.
There you go.
Right.
Okay. Everything that has a cap on it, and all of the caps are similar.
Right, but
Okay.
the white, I want to do the white. So like it's the white, the medicine, the white, the yellow.
And I always tell people the yellow is your door. You lock in your door. That's always last.
Okay.
Okay. Look at this tip.
Uh-huh.
This is the part that's going to go bullseye
Okay.
into your blue.
Okay.
You're going to, most patients find it easier to turn it down and twist.
Okay.
So I'm going to give this back to you so that you can untwist yourself. I need to check your dexterity to make sure you can actually maneuver everything.
So this is, well, I don't have to worry about anything running out,
No.
correct? Okay.
No.
Now you're going to
Put it on and twist.
Put in your forefingers because you won't be able to
Oh,
hold
okay,
tight
so I
enough
can go
to
back
do
to
that.
normal.
Right.
And so then I'm going to stick that in there. Like,
Push and twist. You'll twist it on there. Like you're
right, righty-tighty.
There you go.
Look at you.
Okay, and upside down, air floats up, and flush briskly, and then you'll stop right down here so you can leave some of the fluid.
Okay.
What's briskly mean?
Very fast and quick.
Okay.
I'm going to do it now.
Uh-huh.
Oh, it's on my head to blow off.
Can you feel it at all? Really?
Stop.
Oh, so I don't do the whole, just down.
Just
Okay.
leave some inside.
Okay.
Now the same tip that you have on there, unscrew it and look
Okay.
at it. This
Oh,
is
that's
sterile
pretty
as
easy.
well. It has the same type of tip.
Mhm.
So you go ahead and stick that on there as well.
Okay.
So you want to keep all of your, once you take the protective cap off, you want to make sure it stays sterile. Hold on. Stop.
Yeah, that's what I was going to say. So I'm going to put this back over here. So once it,
Germs
now
are
let me
everywhere.
ask you. Well, I
That's
guess
one of the good reasons why you sanitize your area, because
Yeah,
if you
'cause
don't,
yeah, because I
your
was gonna,
dog's just been licking on it. This won't work.
no.
Yeah.
Because I was going to say if you so I want to actually sanitize this because this is what I dropped.
Right.
Guess it won't hurt to.
Do you have any sanitizing wipes at home?
Well, you don't want to put sanitizing wipes on there. You only want to use alcohol. The sanitizing wipes can be for her
Oh,
area.
okay.
Yeah, you put that on there. You don't know.
But can she sanitize with alcohol too?
Oh yeah.
So, okay. So do you have alcohol at home?
Well, I have the hand sanitizer, but I don't have
Watch
the.
your hand.
Huh?
Watch your hand. You were hovering over. Okay.
Okay, so I want
So
to.
this is, remember, this is your sterile tip.
Right.
So you want to hold it here and then screw
Okay. Good.
without touching.
Okay.
I can call Mike and tell him to go get you
So I don't want to touch that at all.
Right.
Okay.
On any of your tips.
Okay. Make a note. Don't touch tips.
Yeah.
Okay, so
I can
now
call
I'll
Mike
put
and
that
tell him
on
to go
there.
get you some alcohol.
Turn it.
And she can use, like if she has a non-porous surface, a tray, whatever, she can use Clorox wipes, any of those, spick and span, whatever.
Yeah.
So, but Clorox wipes can
But
be used
not
for
on
these.
this. This is
So
only alcohol. And use the swabs, not
I would just
cotton
stick with
balls and any of this
alcohol.
stuff.
Yeah. You can clean that all 9 yards with the alcohol.
Okay, all of them are batch made in the hood all together, just yours meds at the same time. So now you're connected, but it's not going anywhere.
Right.
This is that clip that we're talking about.
Right.
And it's open because you can tell like this.
Right.
I'm gonna clamp it back, so I need to make sure that you can open it as well.
Oh, okay. So I
Now,
open
what
it.
is that?
That's the clamp on the medicine.
Yeah. So it's just
So
basically.
now it started.
Yeah. So basically just unclamped.
Oh, so
you're done.
you put it in, unclamp it.
It's 6:10, so it should be done at 6:50. No, 6:40.
Oh, okay,
It's
wow.
30 minutes.
30
Okay,
minutes.
that's what I was asking earlier. Do you hang this up?
No,
or
ma'am.
It looks like a Christmas ornament
Once
you put on the
open
tree.
this
It's
up,
pressurized?
It's pressurized chamber. It'll open up by itself.
And it'll look like that flat one when it's done, right?
If you ever had any problems with it, you just put it to the side and let us know during business hours. But I've spent hundreds of thousands. I've only had 2 that didn't work.
Oh, okay.
You can feel how taut it is now.
Yeah.
In about 10-15 minutes, you should be able to tell that it's not as tight and as small.
Right. Okay.
You want to make sure it's always, you don't see any flakes, it's not leaking, it's not
Right.
damaged, okay?
Okay. Okay.
$6.40.
That's it.
Oh well.
And so then when that's finished, I'll do that. Then that.
You flush with the saline and then with the heparin. And then when you come in every week, you just come in, you sit in a chair, we take your vitals, we draw your blood, you get your dressing changed again, and you get another week's worth of medicine. Then you go home.
Okay. So just 3 of these a day.
So it's like flush, medicine, flush, saline. Or is it flush, medicine, saline, flush?
Were you saying saline and flush are the same?
Oh, okay. So what's this other one?
That's heparin. That's
Oh,
one at the
okay.
end.
So it's
Heparin is
flush,
a blood
medicine.
thinner, or people loosely say that, and it just sits in your line to prevent it from getting clotted off. It's
Yeah.
all.
So it's
So
flush,
it's kinda
medicine, heparin, flush.
Let's call it saline, antibiotic, saline, heparin.
Oh, okay. So it's every other one.
Because this is
Okay.
more like a medicine.
Yeah.
Right.
Saline, medicine, saline,
And I
medicine.
always tell people, think of a lady's sash. First S is saline, A is antibiotic, second S is saline again, and H is heparin.
Yeah, because
That's
see,
good,
they've got it
sash.
on here.
I like that sash.
Sodium chloride, medication, sodium chloride, heparin.
I like sash though. It's just easier to pick up the order.
Because it sounds easy here, but if you haven't done it before you get home, you'll have S's, have everything.
You'll be a
on the
whiz
stuff.
at it in a couple weeks, but at
Oh no,
first,
she'll be a whiz by
Yeah.
by a couple of days.
yeah.
Okay, now I guess it would be a good idea before I do this, like re-sanitize my hands, because
Yes, you'll be sitting there. Your dog may come up and talk, grandkids, all kinds of things. So
Yeah.
once you know that you're done,
Uh-huh.
you'll get up and you'll go wash your hands again in the same manner that you did
Oh.
before.
okay,
Okay.
People
so
like
what?
sanitizer, but sanitizer ideally is to be used in the absence of water. And the rule originally is once you are in the presence of water, you wash your hands immediately. So if you're not in